So one of the things humans dread the most is diseases. Something as little as headache or abdominal pain can be a pain in the ass, and most of us don't really want to get involved in them. So today we'll be looking at the top 5 worst diseases in the history of humanity. Number 5. Smallpox. A disease that was at a point the most feared enemy of kings and powerful people. Smallpox is definitely what you want to contract by mistake, killing more than 500 people and 300 million in the 20th century alone. It is caused by a virus called variola virus. It is transmitted by the fluid of an infected person, such as the saliva or the fluid from the blisters of the pox. Breathing in a virus or touching infected surfaces can also be another way of getting infected with smallpox. Although the common complication from smallpox is blindness and bronchopneumonia, most deaths occurs from cardiovascular compromise, including high blood pressure and coagulation issues, and this tends to lead to a mortality as high as 30%. Thankfully, smallpox was eradicated in 1980, and only a lab in the United States still has the virus. Number 4. Leprosy. Also called the Hansen disease, leprosy is an infectious Asian disease that causes severe disfiguring of the skin and the nerve agent in the arms, the legs, and the skin areas around the body. The main way to contract leprosy is by repeatedly getting exposed to the droplets of the mouth and the nose of an infected person. Unlike smallpox that has been eradicated from the surface of the earth, leprosy is still much around. In fact, more than 200,000 people are being diagnosed with leprosy yearly, and most of them are in Africa and Asia. When a person contracts the leprosy bacteria called Mycobacterium leprae, it takes about 3 to 5 years for symptoms to appear, and some people do not even develop symptoms until 20 years later. The nerve damage from leprosy will lead to the inability of the leper to feel pain, hereby resulting in loss of limbs due to injuries. Complications from leprosy include blindness or glaucoma, iritis, hair loss, infertility, and kidney failure. Number 3. Rabies. If there is a company built by deadly diseases, rabies would definitely be in the board of directors. With a mortality rate of 99.9%, contracting rabies is definitely a death sentence. It is spread when an infected animal bites or scratches a human. Although dogs are considered the most common spreaders of rabies, bats, cats, skunks, foxes, and raccoons are also carriers. Rabies tortures its victims by causing abnormal behavior, hallucination, hydrophobia, which is the fear of water, and insomnia, which is difficulty in sleeping. One thing worth knowing is rabies is very preventable if a person gets the anti-rabies serum immediately after being bitten or scratched by an animal. Number 2. Neurofibromatosis. These are a group of diseases caused by development of tumors in the nervous system of a human being. Unlike the previous diseases that are caused by bacteria and viruses, neurofibromatosis is either a genetic disorder, meaning you will need a parent to be a carrier, or it can develop spontaneously at the early stage of development of an individual. In the early stage of this disease, multiple brownish dermatological spots called the calf owlet spot can be seen on the body of the person involved. This later progresses into multiple tumors that can be seen on various parts of the body. This disease is associated with various complications including thinking or learning difficulty, skeletal problems, vision problems, cancer, and even severe depression. Sadly, only supportive and symptomatic management can be done as there are no cure for neurofibromatosis. Number 1. Pneumo, also called the cancrum oris. Pneumo is a rapidly progressive and often fatal infection of the mouth and the face. This disease predominantly affects children in the less developed world, such as that in Africa and Asia. Although the causative organism responsible for the disease is common around, an infected person needs to have certain contributing factors to have pneumo. These factors are malnutrition, vitamin deficiency, drinking contaminated water, immunodeficiency, and poor hygiene. Mortality rate for pneumo is as high as 90%, and it can be treated with antibiotics and surgery since its effect on the face is permanent. So what do you guys think about this above disease? Do you think there is a disease that should be on this list? Kindly comment down below and tell us your opinion. Thank you guys for watching the video, and we'll see you another time.